Welcome to Raaonline Anatomy lecture series. In this session, we are going to learn the histology of gastrointestinal tract. Gastrointestinal tract is a tubular structure that extends from the proximal part of esophagus till the anal canal. The histology of gastrointestinal tract is learned by taking sections at various levels. As per CBME curriculum, first MBBS students must be able to describe and identify the microanatomical features of esophagus, fundus and pylorus of stomach, duodenum, jejunum, ileum, large intestine, appendix and cardioesophageal junction. Gastrointestinal tract is a tubular structure. So when we take a section, we see a lumen surrounded by the wall of GIT. The tissues of the wall are arranged in 4 functional layers. From the luminal aspect to the exterior, this is the lumen. This is the lumen of the GIT. From the luminal aspect to the exterior, the layers are mucosa, the submucosa, the muscularis externa, the serosa or the adventitia. So there are 4 functional layers. This is the diagrammatic representation of a section of GIT. So in this you can see 4 layers. This is the lumen of the GIT and here it is the mucosa which consists of the epithelium which is close to the lumen. This first thing is the epithelium, then the underlying connective tissue, that is the lamina propria, and beneath that is the smooth muscle layer which is the muscularis mucosa. So these 3 together constitute the mucosa of the GIT. Underneath the mucosa is a connective tissue layer which is called as the submucosa. The third layer is a smooth muscle layer which is called as the muscularis externa or the muscularis propria, which has 2 arrangement of smooth muscle. So innermost, this smooth muscle is arranged in a circular pattern and the outer layer is the longitudinal arrangement of smooth muscle. The outermost layer is the serosa or the adventitia. Serosa is a squamous epithelium where the organ is covered by visceral peritoneum, and in other areas where it is close to the wall or close to other organs, it is the connective tissue called as adventitia. This is the H&E stained slide of GIT showing the 4 layers. This is the lumen of GIT and these are the layers of mucosa. This is the epithelium, this is lamina propria and this one is the muscularis mucosa. Underneath that is the submucosa and this is the smooth muscle layer. So this is the muscularis externa. The outermost layer is the serosa or the adventitia, which is not seen in this slide. Students are asked to identify or focus any H&E stain slide under the microscope in the 10x magnification, the low magnification. So in that we may or may not see all the layers of GIT. This is a slide of GIT showing all the layers. So this one is the mucosa from here to here. It is the mucosa. This one is the muscularis mucosa and from here to here it is the submucosa and this one is the muscularis externa and a part of the adventitia is C. So in this slide you are seeing all the layers of GIT. In some instances we may not see all the layers. So here you are seeing the epithelium, lamina propria, the muscularis mucosa and the submucosa, and the muscularis externa and the serosa or the adventitia are not visible in this slide. So under the low power microscope in the field of vision, we may or may not see all the layers of GIT. But it is always, we are asked to focus with the epithelium and the part of lumen. So in the given slide, we should be able to identify the epithelium.